So, in addition to having a really, really difficult name, Panayiotopoulos syndrome is also not super common, but we do see it a lot in kids where I practice. Basically, it starts in early childhood between the ages of 3 and 6, but you can see it a little older. It's seen equally in boys and girls, although I've seen it occur in boys a little bit more. Most kids are cognitively completely fine, and the diagnosis is made with an EEG. So, what makes this more interesting than a common epilepsy syndrome? Well, because it presents with focal seizures that don't often look like seizures. They look like migraines, they look like nausea, they look like GI issues. The child might faint, their pupils might get dilated. Sometimes people just think these are migraines, but you put the child on EEG and you'll see seizures, you'll see spike waves coming from the back of the head, and sometimes these smaller seizures can become big tonic-clonic seizures. As mentioned, the diagnosis is usually with an EEG. You see those spiky brain waves. They're in the occipital leads, which are leads that are attached to the back of the head. This specific syndrome is treatable with anti-seizure medications. Sometimes kids outgrow it, sometimes they do not. But if you are worried about this specific syndrome in your child, it's rare enough where I would suggest you go see a specialist, a pediatric epileptologist, or even a pediatric neurologist. One good thing about this type of epilepsy syndrome is the likelihood of the child going on to have adult epilepsy is not very high.